Okay, so we're going to move on to our service provider panel. So as Tiffany and Christina just mentioned, violence is not just a policing problem, it's not just a healthcare problem. This is something that we need more collaborative approaches to. And so I'm very excited to bring up a number of different service providers in the Abbotsford area who are working with victim survivors of different forms of violence. They're going to be talking to us about the importance of access to medical forensic exams and the work that they do with our forensic nurse examining team. So I'll just introduce them and then I'll have them come up and take their seats. We've got a few questions that we're going to be asking them to answer for us today. So joining us today will be Lukvinder Ojla. She's with the Archway Specialized Victim Assistance Program. Lukvinder has been working in the anti-violence sector for over 30 years. Most of her experience has been with Abbotsford and Mission Specialized Victim Assistance Program, also known as SVAP, first as a frontline staff and later as a program supervisor. She first became involved in the anti-violence sector in 1992 as a practicum student from UFE. We love those success stories. In the School of Criminology. While doing her practicum, she realized how difficult and challenging it was for South Asian women to seek help. In 1993, she assisted in writing a successful proposal to receive funding for Indo-Canadian Victim Assistance Program, which still exists under the name of the Multicultural Victim Assistance Program. Over the years, she's been able to secure funding to provide a self-discovery when love hurts support group for South Asian women who are victims of intimate partner violence. And more recently, in 2023, she was successful in securing funding for victim survivors of sexual abuse. In 2010, Lukvinder took part in reviewing the RCMP's domestic violence policy, which was implemented later that year. And around the same time, she assisted in creating the IPV unit in Abbotsford, which is a partnership with the Abbotsford Police Department and the Ministry of Child and Family Development. Lukvinder is very passionate about helping women and children to be safe, stating that intimate partner violence and sexual abuse is not a private matter, but rather a community issue that requires everyone to work together. So we see this theme of collaboration again. And then we have Lucky Verk with Sarah for Women. Lucky Verk has been with Sarah for Women Society since 2009, where she is currently an outreach program manager. Lucky has 20 years of experience in the community, helping empower individuals, women, children, and the vulnerable by giving them tools to navigate resources and support to achieve their goals safely. She's also a proud University of the Fraser Valley graduate with a bachelor's in criminal justice and a minor in sociology. And I'll also add, Lucky is the chair of our Violence Against Women and Relationships Committee, so she's leading the way when it comes to these collaborative responses. And then we have members from our Abbotsford Police Department. So first up, we have Sergeant Jamie Garretts. He's an officer with the Abbotsford Police Department and has been with the Abbotsford Police for the past 25 years. He has a background in patrol, property crime, surveillance, administration, and intimate partner violence. Sergeant Garretts is currently the supervisor in charge of the Abbotsford Police Department's Intimate Partner Violence Unit and has been in this role for the past 3 years. And it's a very good, well set up unit that I'm sure he'll be speaking about when we get to the questions. Great. And last but not least, we have Sergeant Adam Claver. He's with the Sex Crimes Unit at the APD. Adam also graduated from UFE. I'm seeing a nice theme here. Those were the best 2 years, right, out of the 4. For those online, Jamie's just sharing that he is also a UFE alumni as well. So we're very proud to have him. How many here are UFE alumni? Oh, good, like half the room. Love it. Welcome back. So Adam graduated from UFE with a Bachelor of Arts in Criminal Justice. He's a 17-year member of the Abbey PD and has worked in patrol as a detective at the Integrated Homicide Investigation Team, or IHIT, and as a sergeant in major crime, intimate partner violence, IHIT, and now sex crimes. He is an accredited team commander and is part of the Abbey PD Critical Incident Stress Management Team. Adam has been a sergeant for 7 years and is passionate about leadership. He was tasked with building Abbey PD's new sex crimes unit and has been working with the various community partners to ensure this is done with community consultation in mind. Unfortunately, we don't have Corinne Schmidt joining us today. She is a K-File Intimate Partner Violence Crown, and she was called away on an urgent matter, so she's unable to be here, but I know the rest of you will do a great job in sharing your experiences with us. So with that said, please come on up, grab a seat, and we'll start with the questions. So we've asked our panelists to discuss 3 questions regarding the services they provide and how they collaborate with the Forensic Nursing Service here in Abbotsford. So we'll go through each question one at a time and have you each respond as best you can. So The first question will help the audience to better understand the work that you do and the context in which you might see yourself engaging or collaborating with our forensic nursing service. So the first question is, how does your role contribute to the immediate and long-term response to victim survivors of violence?
Okay, so again, Luke Finder from Specialized Victim Services in Abbotsford. We have Specialized Victim Services in Abbotsford and Mission. Community-based victim services, we deal with reported and unreported cases of IPV or sexual assault. Program has been around since 1987. We provide information and support to victims of intimate partner violence and sexual violence. So we do hear from clients that maybe sometimes have to go access forensic services at the hospital. Most of the time that requires them giving some information about the program itself and how to access it. Sometimes people are not sure that they can just walk into the hospital and ask, and sometimes it's very difficult for them to walk in on their own. So we do provide some information so that they, when they walk into the hospital, that they have a bit better knowledge of what to expect. For our services, in addition to that, we provide, lots of court support for those that are going through the court process, and that's from beginning to end, from the time the crime is reported to when it ends in the court system, and sometimes even past that, because we get files that get, to appeal court and supporting through that process. Um, the other piece is counseling and other supports in the community that they can access, so helping them with that. Um, so there's a lot. So the system, sexual assault files can take anywhere from a year to 5 years. I have a file that's in the court system, 5 years to today. So having someone that can carry the file for a long period of time, that's important for us, keeping the same worker on file, because that helps when we're talking about trauma informed practices. We do our best to have the same worker. I'm lucky that I have a team that has been with me for 5, 10, 15, 20 years. So that's our program. I don't know if there was another. So the collaboration, I think the important piece for us as a service provider, frontline workers, is having accurate information. And that, of course, you get when you collaborate with each other and you're part of maybe some committees that you are part of. And Tiffany and Christina sit on the Violence Against Women in Relationship Committee. We gain a lot of knowledge through that. Exchanging information, so that when we do have people that come to us, we're able to give them a better sense of what to expect for the forensic exam. And then that big piece about consent, that they kind of guide that process of how far they want to take it, not take it, should they go get the exam or not, when to go, because sometimes we do get people that come after the 7-day period, and then what? They may still have some medical needs. So understanding the services that exist in our community is really important. And that, I think, only happens if you are collaborating with each other. And if that collaboration isn't there, you're working by yourself and you're not going to achieve as much. It's not, we're not doing justice to the person.
Hi, and thank you for coming, everyone. So lucky, as Amanda said, from Sarah for Women Society. And at Sarah for Women, we provide various services. So like we have the counseling department, we have like STV counseling, we have peace counseling for children, and then we have second stage housing, we have the Christine Lamb residence, and then we also have Christine Lamb residence and Cheryl Smith's residence, sorry, and they're both are 18-month stay. And Cheryl Smith's is like the pet friendly as well. And then we have transition houses in Abbotsford and Mission. And then we also have our outreach services that that I manage. And for its outreach services, we have We also have a portfolio for HIV clients. We also have one for, OPS and harm reduction and multicultural services. And how we collaborate with forensic nursing and everybody in the community is it's very important information sharing, because anything knowledge is power, right? So, and sometimes when our clients are referred to us, so we refer to forensic nursing, and we also receive sometimes referrals from forensic nursing, because when a woman comes in that's traumatized, has been through so much, she doesn't know what services are available to her. And so when we're able to explain to her the process and other services, what other services provide, then they know, like, oh, I didn't know that there's a service available for this. Because those injuries, they don't realize, if they don't see anything on them, they don't know that, like, if there's no bruising, then they don't understand that, oh, there could be an internal situation. So referring them, walking them, taking them to, the hospital, it makes a huge difference, right? Because they could be like dealing with something that's very severe. We've actually had that happen, where we have taken someone in and those injuries were very severe, but thanks to forensic nursing and their services for that. I think I've touched what our services do and all that. Yeah.
Hi, I'm Jamie with the Abbotsford Intimate Partner Violence Unit. Give you a little bit about our unit. We are embedded within the Abbotsford Police Department, which is unique in the province to have everybody working within the building and within the police agency. We are made up of 2 specialized victim service workers from Archway Community Services, 2 child protection social workers from MCFD, and we now have 4 police officers, including myself, and 3 detectives working in the unit. We very seldom receive a file in our unit before that 7 days has already expired for us. So it's very important for our unit with the education piece in the department to ensure patrol members, who are those first responders involved in these violence incidents, that they're encouraging and trying to get them down to the hospital first and foremost, as Tiffany and Christina said, for the medical piece to make sure they're well. But then the evidence collection is paramount, because by the time we do receive the file within that sort of week to 10 days, if that hasn't been done, it's again just a huge miss. It's a huge evidence based piece that's going to push it forward through the courts that we don't have. But we collaborate a ton with them, because we are involved in all these same working groups with them. And we call them all the time and email back for all the time, just asking their opinions on things and trying to figure out what we're going to do going forward. It is too bad we don't have Crown here, because of course the evidence piece that we're working towards and trying to get is what they benefit from as they take it forward. And of course, Crown is like, when they get the photos from the nurses and instead of our crappy police ones from our cell phones that we're trying to do at the scene, and we've actually got these really good, the cameras that they have and evidence of the injuries, that Crown just looks at it and is just shows so much for them. So that's.
My name is Adams. I'm in charge of the sex crimes unit at the Abbotsford Police Department. We're a new unit, so we officially launched at the beginning of May. I've been planning it since January, so we're very trauma-informed, victim-centered, so I wanted to build the unit with that view to begin with. So one of my first calls was to Amanda, and I've spoken to Christina at length. Yeah, like in hearing a conversation on involving police in these files, and like one of my big messaging is like, we want to be able to connect with survivors and give those options from the police perspective, and have that put a face to a name and know that we are going to follow the wishes of the survivor. So obviously in police, we want to do what we can to bring the offender to justice, but we will do that only with the consent and the participation of the survivor. So it's important for us to get out there and make sure that we spread that message as well. So Christine and I have a lot of conversations back and forth, part of monthly meetings at ARH with their hospital management on collaboration, how we can do things better. Christine and I have been talking about having a space where when survivors come in, there's a room where they can go to where it's a private space away from everything else, and we can have conversations, have victim services or specialized victim services come along. We work very closely with Sue back there is from our police-based victim services, so we work quite often with her. Forensic nursing directly, we try to accompany survivors that report directly to police. So we want to be advocates for them at the hospital. So often we will accompany them to the hospital along with Sue and her team with victim services. And then whatever needs to happen, we kind of are there for them throughout. So very excited along with Christina and Tiffany about the added service at ARH. We've taken a few survivors to Surrey, which again is part of what we want to do is be there for them regardless it's at Abbotsford or at Surrey, but having that service at ARH is going to be awesome for us. So thank you again for all your work on that.
Thank you so much. Lucky, you already mentioned an example of a situation where the forensic nurses detected an underlying injury that maybe the patient wasn't aware of. As we talked briefly about this with Christina and Tiffany's presentation, that sometimes survivors of strangulation or who've had head trauma, for example, might have a brain injury. These are not necessarily things that are just visible to the naked eye, but they are things that our forensic nurses are specially trained to look for, in contrast to many physicians who don't have that level of knowledge about the potential dangers of strangulation. I'm going to go off on a slight tangent. Strangulation is my particular area of research. And so just as an example of what you might see, a person who has been strangled, it takes very little pressure on the neck in order to cause internal injuries. Because there's so little pressure, you may not see anything on the neck. There might not be any red marks. There might not be any bruising. There's no outward sign that somebody has been strangled. Yet on the inside, they might be suffering from internal injuries, including something called a carotid dissection. Essentially, they're bleeding out internally and they're at risk of having a stroke. Forensic nurse examiners are trained in this knowledge. They know what to look for. They know the questions to ask. They have the ability to be able to detect these kinds of injuries. And through their role and through Embrace Clinic, which we'll hear about next, they have the ability to support survivors. So Lucky, you kind of alluded to that in your statement, but I'm just wondering if anybody else has any examples they'd like to share of where a collaboration with our forensic nursing team maybe changed the trajectory of a victim's pathway or maybe even of the case.
Really get Lindley up here, who's one of my detectives on the team. But we just had a recent file. We've obviously not used names or any designations, but this woman had experienced for the first time a very significant assault, which, you know, I think was a bit of a surprise, but it was a significant strangulation. She ended up going to ARH and seeing the forensic nurses there, as well as a really switched on doctor. And I wish I knew that doctor's name. I think I need to dig that out. But between the nurses and the doctor, the doctor ordered the CT scan. She went for that, came back with a bilateral dissection, which was very serious. They got her on medications right away. She was then, after her forensic exam, forwarded on to the Embrace Clinic for even more follow-up, more treatments to help her deal with the neck pain and things she was dealing with. And she's been back into our office, I want to say at least 4 times, if not more, for interviews and follow-ups, which is a lot to ask from somebody to keep coming back. But she has such a buy-in with our team and with the police and with the nurses and the medical and her whole experience so far, because they caught I believe they caught such a serious medical condition. And everybody's showing nothing but care for her the whole way along, that now every time one of our investigators is like, I'm sorry, I need to get you back in. Oh, I need to get one of your kids back in for another follow-up. But this file is just progressing through, and it will, again, totally secondary to her health and wellness, but the success I believe that this will have through the courts and her safety going forward and conditions that can be put in place and things that will just allow her to carry on with her life it's immeasurable, really. So, yeah.
Just going to add, even with that,
you know, the evidence that the forensic nurses would have collected that for the case, and for her to know that that's an additional support in some ways, right? It's not just her saying this happened. So very important.
Oh, and I was just going to add, Amanda, quickly to the example that I used. At first, when she had gone in to see her family physician, the client that I'm talking about, she was told that it may be a soft injury, but because staff were aware of what the services are available in the hospital, we're able to say, hey, no, it's up to you because we have to have your consent, but we think it's a great idea if you go get it checked out. So, and then it was like treatment. She was given treatment and exams were done just to rule out if there was anything else needed. So, and I always appreciate that we have that service to come in to train training to our staff about strangulation. So just wanted to add that on.
I think the reality is sometimes, people still feel that they just need to go to their doctor. And unfortunately, not a lot of the doctors don't have the information that Tiffany and Christina have shared with us. We've had situations where the client comes to our office and you can hear in their voice that and after they tell us that they were strangled, and you're like, you need to get to the hospital, gotta get this checked. They're like, oh, but I have an appointment with my doctor, I'm fine. It's really, sometimes it takes a lot of convincing to get them there, because we're just victim services. They're looking at, well, I got to get my doctor's opinion, right? But it's getting better with the knowledge that we've gained over the years through the forensic team and the other trainings that we've gone to. But so important to encourage people.
I think for me as well, as police, we collect evidence and we need that to prosecute a crime. Of course, we can't collect this evidence without forensic nurses. So it's vitally important, and it's been mentioned before about every step of the process, how important it is that the survivor feels like they're being heard and they're being listened to and they're being looked after. That's a huge part of it as well. So it's a very intensive exam. And I mean, I can give countless examples of cases that not only do we need this evidence, maybe to identify an offender or to move the case forward, but we also need to make sure that the survivor is kept on side. And when they have a positive experience through forensic nursing, that makes the world of difference to us for how we're going to support the survivor throughout the whole prosecution. So, a huge part is just that evidence collection that we need for court, but it goes much beyond that in the experience during the exam as well. So.
Thank you so much. Well said. And that was a great segue into the next question I'd like to ask you. So in light of this year's Victims and Survivors of Crime Week theme, being the power of collaboration, we'd like you to consider the value of collaboration and what would happen without forensic nurses. So more specifically, can you speak to the value of collaboration as a member of this sort of multidisciplinary response to violence in our community, and what the impact would be on your cases and files if we didn't have access to forensic nurses?
Yeah, holding mic. No, I was just gonna say that collaboration is huge. Without having the community partners in Abbotsford and elsewhere, we wouldn't be able to do the work and provide the utmost services, wraparound services for the women and children or the victims we serve. So with forensic nursing, because of the collaboration we have with them and the relationship, and if we didn't have that, I think some of these women would unfortunately be dead. It could lead to death. And that's why it's so important. Education is power, and empowering women to even seek those services is huge, right? So, and being in, having that relationship with Abbotsford Police, with Victim Services, with MCFD, be able to share information, of course, with consent from the client, right? And looking at other factors, it's huge. And having that relationship to make sure we have checked all the boxes, and we can't do that if we don't have that collaboration. So I really value, and I know at SARA we value collaboration. It's so huge. Yeah.
I would, well said. I will add to that. I don't think you can do this work alone. I think that cases will fall through cracks. People won't access services, right? Because it's not just about one service. It's not just about police, about court or Crown or us. I think in order to do a better job, we all have to work together. And I tell people that Abbotsford is one of the best communities to work in because we all collaborate really well, and that doesn't mean it just ends here. It's an ongoing partnership. Our newest partnership with the sex crime unit. I mean, Adam from day one has been consulting and collaborating with all of us, and that is so appreciated by a lot of the community programs because that's what we need from our department, our police department, to do that. We're working on a space for our clients to be interviewed in the community setting versus in a police setting if that's what they need to support them better. And I think that we talk about why people don't report. That's why people don't report, because when there is that breakdown of services not working together, it's not about us, it's about the women that we're working with.
Yeah, I think, I mean, to be blunt, we wouldn't be able to do our job without forensic nursing. So, I mean, there'd be countless offenders out there that would be re-victimizing because we wouldn't be able to collect DNA evidence to then link to this particular offender and then be able to arrest and eventually charge that person. So, I mean, we need forensic nursing to be able to do kind of everything we do. So, thank you on the collaboration piece. It's really important to me that we do all work together, and it's important that the survivors see that we are all working together, and it's not just working in silos of police and all that. And we had a direct referral from a service provider, which I'm very proud of because, there's a lot of barriers to reporting to police, and we've been meeting with different service providers, and I want a direct connection from the community to police. So, if someone is very reluctant to report and then they're having to go down to the office and wait in line and be around with everybody else, or they're having to call and wait on hold, and then have a uniformed officer come to their house. We want a method where our service providers, our community providers are able to connect directly with us in sex crimes, and then we can have trusted officers that they already know that can then deal with their client in the best way possible. So we're working on trying to put that in place. And like I say, I just had a recent example of that. We got one directly, and we're able to communicate directly with the survivor without them ever having to call into non-emergency or coming into the office. We just connect with them directly, and on their terms, we figure out what's best to meet, where's best to meet. Luke Vinder's been gracious to offer office space even before we get something formalized set up, but we can go to her office where she already has her SVAP workers there and make sure that we're doing right by the survivor. So again, like our view is whatever we can to support the survivor to make a report. If they don't want to make a report at that time, that's fine too, echoing what Christina's saying with forensic nursing. We're happy to support in any way if they want to come back in a month or 2 years, or that's completely up to them. And we'll do what we can to make sure that we hold on to that evidence should they want to come forward in the future. So.
So I was at a meeting, I can't remember how many months ago, with Tiffany there, and throwing out this terrible number 24 that was on the screen, like this horrendous amount of strangulations or assaults or interpersonal violence that's occurred, and then only 24. So I've racked my brain trying to figure out why that is, because it's not always just police that are bringing people. People are like as their slide said, people are coming on their own, they're coming with support workers. But why it's so low, we obviously need to work on that and get that higher. I was started to hear the rumblings of this improved service model at the hospital, and the dedication by Fraser Health to providing the full time, because I remember talking to Christina over October was a year ago when they launched that year from October to October of trying to commit to providing full-time service from 8 till 4 every day. Tiffany saying how that was going to be to show that this is how important it is. And then of course we come up with number 24 there, but it wasn't looking so good at the end of that by the sound of it. So when I started hearing, and then I guess it's rolling to have this full coverage, that's amazing. The collaboration piece with the forensic nurses, for bulk of my experience with them has been the education piece about like coming either by the department. It's been way too long since we've had them by, so we've got to work on getting them over to the department through the briefings for the first responders that end up at most of these calls. But what strangulation looks like and what lots of things look like, but the focus since 2020 when it became part of the criminal code is a standalone charge. What that looks like, because lots of times you'll read a report and they just talk about being grabbed around the neck, but they don't dig down on what that means, because as Amanda said, very light pressure there can cause serious damage. So I love stats. I mean, whatever, cops love stats, but anyways, I like to throw out the numbers that since 2018, it hovers at where between 37 to almost 40% of all the files we send forward to Crown Council have a domestic violence component. It's huge. Out of all the files that the police you think of in a town that are sending forward to Crown Council, almost 40% of them involve some level of intimate partner violence. Of those, so that works out to around just shy of 500 what we call report to Crown Councils that go forward to Crown with charges involving intimate partner violence. And in the last few years, last 3 years, it's been around 75 cases of strangulation involved in that charging. Well, if only 24 total have shown up at the hospital, and that's not just the police, but that's other people just walking in on their own or coming through service providers, that's not nearly enough. If we were looking at it like that, there was enough of a component on this file to add a strangulation or choking as it's termed in the criminal code. But anyways, we need to bring that number up, and everybody, and the collaboration among everybody in this room and in our unit, from specialized victim service to social workers and obviously the nurses, we need to get the number up.
Thank you so much for that. I really appreciate you all sharing your perspectives. I mean, the reason that we invited our Abbotsford team to be here to present today is because they are a very strong example of what successful collaboration can look like. And you can see that it goes both ways. I mean, everybody here is working together and helping. The goal is to help the victim survivor to be healthy and to be safe. So I would encourage you, if you're from communities outside of the Fraser Valley, I know we've got people from across British Columbia joining us online today, please do reach out to the forensic nursing team, the policing, whether there's police-based victim services or community-based victim services in your communities, and start to build these relationships, because when you have those relationships, it's really the best thing for the victim survivor to be able to get access to all the various supports that they need. So with that said, we are running out of time. We need to make sure that Hannah's got time for Embrace Clinic. We're going to talk about Surrey in just a minute, but I do want to just check if there's any questions. Yes, hi. Do you want to just grab a microphone? Thank you.
Question for the police officer concerning DNA. Do you have a national-wide base where you submit all the DNA to in Canada?
Yes, we do.
What's the name of it?
It's called CODIS. The RCMP administers it for
Okay, that's
Canada.
like the US has CODIS. So it's not just you communicate with the RCMP gets involved, or?
Yes, the RCMP does national policing services for Canada, as we know. So the forensic labs are operated by the RCMP nationally. So when Christina and her team from forensic nursing provide us with samples, that goes to the RCMP lab. We have one in Surrey that then gets checked against the national database, and then that's how we would get records returned on offender matches.
And do they connect with CODIS in the US? Do they connect?
It's not connected with
So
the
they're
US.
not
It's a
connected with
Canadian.
the US and Canada, because if criminals cross the border, like back and forth. And I had another question, I forget. Now, every criminal in Canada, when they commit a criminal act, do they get their DNA collected automatically?
It's only DNA designated offenses. So there's a list of offenses where DNA collection is mandatory, and then the vast majority is not.
Is rape one of them, like mandatory to get any violent sexual
Sexual assault is one of them, yeah.
is one of them. So you'd have to find out yourself, like,
In the criminal code, there's a list of the DNA designated
so I
offenses.
could
but-
find out in the criminal code for that. And another quick question is, I know this lady, Sarah, it's just for women. So you include all these services for men and unfortunately children.
Yes, we do.
These,
Specialized Victim Services. It's women, children, and we do have some adult survivors of sexual abuse, men. And within our agency, we also have counseling, trauma counseling, and it's also we do also have a male counselor that sees male victims right now.
Okay, thank you.
Thank you so much. Okay, well, thank you very much to our service providers for being willing to share their stories. We appreciate it.